Hello. The scene is safe. Patient appears to be stated age, well-mannered. Vital signs are normal and within range. How you doing today?
Good, how are you?
Good. My name is Mandy Torres. I'm going to be your family nurse practitioner. Can you just start by telling me your full name and your birthday?
Margaret Strout, 8/12/97.
All right. Thank you. So today we're going to be doing an abdominal assessment. Before we get started, Margaret, do you have any concerns? Have you had any tenderness in your abdomen, any changes in your bowels and your appetite, any issues swallowing?
No.
No. Okay. All right. So this portion of the exam, I am going to have you lay down.
Okay.
Okay. So you go ahead and do that.
Alrighty.
And for the purposes of this exam, we will not be exposing the full area of the abdomen that we would on a actual patient. So we're only going to be covering to about here to here. Okay, I'm going to go ahead and lift your shirt up.
Go
Okay,
ahead.
Margaret? I'll just pull down just a little bit. Does that feel okay?
Yep.
All right, so the skin appears to be intact with no lesions, no rashes, no dilated veins. The abdomen appears to be symmetrical, round, and flat with no visible distension or bulging. The umbilicus is centrally located without any signs of inflammation or bulging. There's no discharge or herniation, and no visible peristalsis or aortic pulses noted on inspection. So this portion of the exam, Maggie, I'm going to go ahead and just listen to your stomach, okay?
Mm-hmm.
And for the purposes of this exam, I would in fact be going underneath, but we're just going to leave Margaret's pants right here. Sounds are active in all four quadrants, occurring at a regular frequency of 5 to 30 sounds per minute. No hyperactive, hypoactive, or absence bowel sounds heard. No bruits auscultated on the aortic, renal, iliac, or femoral arteries, and no venous hums or friction rubs heard on auscultation. Of our exam is I'm going to go ahead and just do some tapping on your stomach, okay? Okay, so I would mark that area right there. Right there. Okay. To tympani. Tympani is heard throughout the bowel sound, including the splenic flexure. Dullness is heard over the liver, and the span of the liver dullness measures 8 centimeters. No signs of splenomegaly based on percussion, and patient denies any CV tenderness upon percussion. No signs of ascites heard on percussion as well. And then, Maggie, the next proportion of this exam is I'm just going to go ahead and do some light touching first and then some deeper touching. If you feel any tenderness along the way, please just let me know, okay?
Okay.
do some deeper?
Yeah.
I'm gonna go and feel down here. And while I'm doing that, would you mind just taking a deep breath for me?
Mm-hmm.
Okay. Same thing over here. Right. I feel in the kidney. Okay. No tenderness or guarding of superficial masses found on light palpation. Also, deep palpation shows no signs of mass or tenderness. Patient is negative for any rebound tenderness. The liver, edge, spleen, and kidneys were palpated and show no signs of enlargement or tenderness. The aortic measures about 3 centimeters, and patient is negative for Rossing signs, O signs, and Abuter signs, which show no concerns for appendicitis. And the patient also is negative for Murphy signs, which shows no concerns for cholecystitis based on palpation. And patient denies any tenderness at McBurney's point.